I got my Medicare information. That's right, I am now eligible for Medicare. So I thought this would be a good time for me to talk about Medicare. As a nurse, when I was working, so many of my patients did not know basics about Medicare. They did not know what it is. They did not know if they were eligible, how to get Medicare, or even if you had to pay for Medicare. Medicare is very complex and it changes all the time. So I'm pretty sure I'm going to do more than one part about Medicare. I may even have to do 3 parts. So today, this is part 1 about Medicare. So subscribe to my channel, hit the notification bell so you will know when I upload part 2 and maybe even a part 3. If you have any questions about Medicare, or if there is something you want me to cover about Medicare, put it in the comments below. So, what is Medicare? Today I'm going to cover what is Medicare, give you some basics about Medicare, and let you know what you need to do in preparation, like Nurse Marsha, to prepare for your Medicare. I'm going to take you on my journey as I am preparing for Medicare. Now, my Medicare will be effective in February 2024, and I just got the information in the mail. What is Medicare? Medicare is a federal insurance program. This program was started in 1965 to help the elderly or seniors to pay for their health care needs. And guess what? It is not free. How is Medicare paid? A variety of ways. First of all, Medicare is paid by people, citizens who worked. When we worked, we had that withholding federal income tax coming out of our paychecks. Some of that money from our withholdings and our paychecks went to a fund, a Medicare fund that the government established years ago. Remember, I said this program was started in 1965. So it's paid for by monies that we put into the Medicare fund while we were working through the federal taxes that was withheld out of our paychecks. Also, companies that we worked for, they pay payroll taxes. A portion of that is also set aside for Medicare. Some people have to pay taxes on their Social Security or Social Security disability income. Those taxes goes into the Medicare fund. The government does put money into that Medicare fund. So what am I talking about a Medicare fund? Well, there have been a trust fund created for Medicare. That money is only supposed to be used to help support the Medicare system. Also, that trust fund, they invest and they get interest rates back on their investments, and that money stays in that fund for Medicare support. We pay for what is called Medicare B. We pay a premium for Medicare B, and I'm going to talk more about that in just a few minutes. So those premiums go into the Medicare fund. My takeaway here, or what I would like for you to take away, is that Medicare is not free. Who is eligible for Medicare? In the United States, you are eligible for Medicare in a few different ways. Age 65, you become eligible for Medicare. If you are disabled, receiving disability benefits, and if you've been receiving those benefits and you're not 65, but you have been receiving Social Security disability for greater than 25 months, you are eligible for Medicare. If you are not 65 and you are a person that has what we call end-stage kidney disease, you are eligible for Medicare. I'm going to talk about just basics Medicare. Remember, I said that I'm going to do more than one video about Medicare. Again, subscribe to the channel and hit the notification bell so you will know when I upload Medicare Part 2. Basics about Medicare. There are, I'm going to say, two parts to a basic Medicare. Medicare Part A and Medicare Part B. When you get your card from Medicare, you're going to have Part A and it's going to say Part B with the effective dates. Of course, we have some other alphabets, and again, I'm going to cover those later on in a follow-up video. So again, please subscribe and hit the notification bell so you will be able to get Part 2 and maybe Part 3 about Medicare if I need to do a 3-part series, okay? What is Medicare Part A? Medicare Part A is typically what they call hospital insurance. Medicare Part A covers things like hospital services if you need to be put in the hospital, skilled care or skilled facility services. For example, if a person breaks their hip and they need to go in a rehab center for physical therapy and recovery, that comes out of Medicare Part A. It also covers home care services. Secondly, there is originally a Medicare Part B. That is considered medical coverage or medical insurance. What does the medical insurance cover? That covers the doctor fees. It covers when you go and see a doctor. It also covers, again, some home care services. It will also cover medical equipment. Now, I'm going to talk to you about another program called Medicare Part D. Medicare Part D stands for drugs. You can remember it, D and drugs. That is a program that was started in 2006 because prior to that, we had no prescription coverage. We had to pay for our medications out of pocket. So in 2006, the government decided to give us an opportunity at a lower rate to buy a prescription coverage to add to our Medicare program. Do you have to even apply for Medicare? How do I even get my Medicare? So how does the government even know that you're eligible for Medicare? Good question. If you are retired and you went to the Social Security and you said, hey, I'm retired, I want to start getting my retirement income, or if you have become disabled and you are getting disability income from the Social Security, then they have that baseline data. And when we are eligible for the Medicare, they just send you that information, just like Nurse Marsha got with her Medicare. Get ready for Medicare. And I got my card. I'm going to leave in the description the 1-800 number for Social Security. So I told you I was going to share with you. First thing I did, I'm reading everything that came in the packet. Get ready for Medicare. There is a letter that they sent. Here is a nice little cheat sheet that they sent about what I need to do and what decisions you have to make. First of all, I want to say Nurse Marsha read it all. That booklet that I showed you is a very easy read. It's very simple to understand because it's letting us know that we have to make some decisions about Medicare. The next thing I did, it advises you to go to medicare.gov, and I'm going to leave that website in the description below. It tells you to go to medicare.gov and create an account. You have to make some decisions about if you're going to keep original Medicare. You need to choose a Medicare Part D, as in drug prescription coverage. And also we have a new thing. It's not really new, but there is another option called Medicare Advantage. Now in this video, I won't be talking about Medicare Advantage. I'll talk to you about Medicare Advantage in the next video. But those are the basics decisions that you have to make. And I want you to have the most information as possible. So again, go to the website, medicare.gov. So I hope this helped. I hope you found value in what I'm sharing with you today about Medicare. Now, don't forget, I'm going to do another part because the next thing Nurse Marsha has to do, I have to choose a Medicare Part D. Subscribe to my channel, hit the notification bell.